runny nose, cough, fever, and body aches. These are some common symptoms of influenza, otherwise known as the flu. These symptoms can cause discomfort and interfere with our daily lives. Yet, the simple flu virus can be deadly.
Ma'am, wake up, ma'am! Ma'am!
In today's episode, we put the spotlight on the flu virus and pneumococcal disease. Through two stories inspired by real-life cases, we'll show you how these common vaccine-preventable diseases can pose a threat to your loved ones and how you can prevent it. We'll also be talking to veteran actor Matya Lagan, who will share his experiences. But first, let's take a look at the story of a 67-year-old woman who caught the flu virus, which resulted in a threat to her life.
Ma'am!
Mrs. Tan Mei Lian is a 67-year-old retiree who enjoys an active lifestyle with her husband. Several times a week, the elderly couple, together with their helper, would give themselves a treat by eating out. It was during one of these outings that Mrs. Tan contracted the flu virus.
Influenza virus is spread by droplet spread. So when someone coughs or sneezes, the little droplets that fall contain the virus. Well, when someone is having a fever, or while they're still coughing and sneezing, that's usually when they're most contagious. Now, sometimes people can cough and rub their nose and touch a doorknob, and so you can get infected from virus that has landed on surfaces that are contaminated.
A few days after coming into contact with the man at the food center, both Mrs. Tan and Mina fell ill.
是不是感冒了？
不知道，好像不舒服吧。
You also sick.
A little bit, sir.
Mina, you don't do any work. Go and take a good rest.
Thank you, ma'am. Thank you.
Both Mr. Tan and Mrs. Tan were not too concerned about what they thought was a common cold.
You know, it's often hard for a regular person or even for a doctor to tell the difference between a cough and cold versus influenza. So certainly if there's fever and body aches with a cough and cold, that's much more likely to be influenza. If it's just a cough and cold runny nose without a fever, then that's more likely a cold rhinovirus. But the thing that often sets it apart for influenza is the high fever and the body aches.
Sir, breakfast is ready.
Where's ma'am?
Ma'am? Ma'am's still sleeping.
After a good rest, Mina felt better and was able to go about her household chores. Mrs. Tan, on the other hand, had taken a turn for the worse.
要不要吃早餐？
我等一下才吃吧。
She was too weak to get out of bed and was running a fever.
Flu is a viral infection. When any person gets an infection, the virus enters the body. In the case of influenza, you inhale it. The virus actually replicates, it multiplies in your body. The risk of complications for influenza is higher in older people. But just because it's higher, it doesn't mean it doesn't happen in younger people. And one of the complications, that can result is problems with the heart and lungs, where they end up needing support.
Treating the symptoms lightly, Mrs. Tan did not see a doctor and self-medicated when she did not get better. She had hoped to get well like she did before in the past.
Ma'am, what you need, I have you take?
No, it's okay. You go and do your work. Go.
But this time, things were different.
我不明白，他怎么突然会有心脏病？
他的心脏病是流感引起的并发症。
The flu virus triggers a heart attack mainly because you're running a temperature of, say, 39, and you might be doing that for several days. So that very high temperature causes your heart to race, to go fast. There's less time for the blood supply to fill the coronary vessels. So the heart muscle, which is working harder, is also getting less blood supply. So that's a reason that people can then get a heart attack. The other reason that older people tend to wind up in hospital or get sicker from influenza is just that as they get older, there's more time to pick up different medical conditions. So the influenza infection, the fever, the post-influenza complications are more likely to destabilize their medical condition. So it's just easier for older people to get complications from flu.
回家了。
好啊，我也想回家。
Fortunately for Mrs. Tan, she was able to recover from the complications after a few weeks of treatment. Had she been vaccinated, she could have avoided this painful ordeal.
We have this saying in public health, an outbreak averted makes no headlines. Prevention actually tends to fail because of success. You know, when you prevent things for so long, people no longer know to be scared of that disease. People don't want to take the vaccine because they haven't seen the complications. If you're healthy, we'd like to keep you healthy. And the flu vaccine makes it more likely for you to stay healthy. So vaccine works by presenting those proteins to your immune system ahead of time so that you can actually recognize those bad guys, those viruses, when you get exposed or infected with them. And with an enhanced immune response, abort the infection. Flu vaccine is required yearly because the virus mutates and changes. And so every year, we have to see how the influenza virus is changing and then manufacture several 100 million doses of vaccine to try to stop that virus from causing infection or disease. So it's got to be done every year because that virus is changing quite rapidly.
While it is important that the elderly are vaccinated, the rest of us can play a part in preventing outbreaks by being vaccinated ourselves. This way, we not only protect ourselves from being infected, we also lower the risk of passing on the infection to our loved ones. After the break, we take a look at an infection that is a major cause of death worldwide. Bacteria is all around us, in our environment and in our bodies. They are a part of us, both good and bad. Bacteria that is harmful can cause illnesses. One such example is the pneumococcal disease, an infection caused by the bacteria known as Pneumococcus. It can lead to an infection of different organs and is also one of the most common causes of severe pneumonia. Here is the story of Madam Bhavani.
Mom, are you all right? I think we should go to the hospital.
Madam Bhavani is a retired teacher who lives with her daughter. She does volunteer work during her free time and enjoys visiting new food stalls around the neighborhood.
Quick, the rojak here is very good. We're gonna get sold out soon.
Okay, let's go.
Madam Bhavani leads a healthy life by eating well and being physically active. But even then, she's not immune to bacterial infections that are present everywhere around us.
You want tissue?
Oh, thank you. Thank you so much.
In a lot of cases, when people get a cough, people just start, with antibiotics, or they never even end up seeing the doctor. In every disease, there's a range of infection from mild to severe. A pneumococcal disease, the proper name is strep pneumoniae. It's a bacteria, and it's a bacteria that causes anything from ear infections to bronchitis, where people cough, to pneumonias. But it can also get into the bloodstream, causing a bloodstream infection. It can cause meningitis, where it infects the fluid around the brain. And so pneumococcal disease is one of the most common of the bacterial infections when we know what causes pneumonia.
A few days later, Madame Bhavani started to develop a cough.
Mom, are you okay?
Must be the belacan.
Oh, why don't you go rest? I'll finish up here.
Okay.
At night, Madame Bhavani's coughing worsened and her daughter became worried.
Mom, are you all right? Here, have some water. I think we should go to the hospital.
So typically, if you get pneumococcal pneumonia, they can get very high fevers. They can have shaking chills. There's often a very bad cough because the lungs are infected. Typically, if you get an infection, you have to send the sputum sample to the lab to get tested. And we do find pneumococcal infection. We often see that it's associated with quite severe damage, long-term, disability, or even death.
Breathe in. Breathe in.
Doctor, what's wrong with my mother?
Your mother has pneumonia and there is fluid in her lungs.
So pneumococcal infection is one of the major causes of death worldwide. People who are older, even if they have no medical problems, are at increased risk for complications. With pneumococcal infection, if you had pneumococcal pneumonia, then typically with the pneumonia, people find it hard to breathe. They might get chest pain. They're coughing up phlegm, and that infection can then develop pus around the lungs, which may, as I said, require antibiotics, but sometimes a chest tube to drain out the pus.
Madame Bhavani's left lung had deflated to only 50% capacity. She barely survived. This is due to a condition called empyema, a complication brought on by the pneumococcal disease.
When the body is fighting an infection, the body is sending white blood cells in to fight the bad guys, the bacteria. And as it does that, it creates what we call pus. So empyema is basically pus in the lung that has to get drained out. For empyema, you have to treat it by putting in a chest tube to drain the infected fluid out.
Mom.
Fortunately for Madame Bhavani, she was able to recover after the surgical insertion of a chest tube and taking antibiotics. But for an elderly patient, a collection of pus between the lungs and the inner chest wall can be a serious condition.
Despite being a vaccine-preventable disease, the uptake of pneumococcal vaccines in Singapore is currently low. Based on the National Population Health Survey of 2019, only 10% of people aged 65 to 74 are vaccinated against pneumococcal disease, and 24% are vaccinated against influenza. After the break, we invite Professor Lim Po Lian from the National Centre for Infectious Diseases, as well as veteran actor Mathia Lagan for a discussion on vaccinations. Joining us today for the discussion is Associate Professor Lim Po Lian from the National Centre for Infectious Diseases. Welcome, Prof.
Thank you.
And also veteran actor and household name, Mr. Mathia Lagan. Welcome, Madi.
Hi, Diana.
So, Prof, please tell us the difference between the cold and flu.
So a cold is when you have, sneezing, a runny nose, a bit of scratchy or sore throat, and not much fever. And a flu or real influenza caused by the virus is usually all of the above symptoms. But in addition to that, you have a high fever, severe body aches, and people feel very, very exhausted. Flu in general will last longer. Sometimes people can be sick for weeks. especially with complications, whereas a cold usually will last a few days, usually not more than a week.
Okay.
So when we go to the doctor, he asks you, what do you have? I say flu. So I'm most of the time wrong?
Often for many regular people, flu is the short form for saying that whole
Exactly.
grouping of symptoms.
So the actual flu is different from what we conceive as flu, right?
Yes, that's correct.
Maddie, what do you do when you have the flu?
When I have the flu, maybe body ache, I pop in some painkillers, sore throat, lozenges or cough medicine or something like that. Wait a couple of days and then go and see a doctor. Is that the right thing to do?
For the most part, if you don't feel that sick, it's okay to take medicine for symptoms. So some medicine for fever, lozenges for a sore throat. But certainly if your fever is high, or you're starting to feel worse and worse, you get shortness of breath, then you should go see a doctor. The most important way you can prevent the spread is by washing your hands with soap and water. And if you're sick, resting at home, wearing a surgical mask so that you're not spreading the infection to others. And if you're coughing, try to cough into your elbow instead of on your hands and touching a doorknob and spreading the infection that way.
Prof, we've heard about pneumococcal disease. What exactly is that and what are the symptoms?
Pneumococcal disease is very different from influenza because influenza is a virus and pneumococcal is, the other name is strep pneumoniae, Streptococcus pneumoniae. So it's a bacteria. It causes a whole range of infections from bronchitis, sinusitis, ear infections, to pneumonias. But what many people don't know about pneumococcus is that it can get even more serious than a pneumonia. It can enter your bloodstream to cause a bloodstream infection. It can attack the meninges, so you can get a meningitis, which is an infection of the fluid around the brain. These are infections which are contagious and can spread easily and can be especially serious in people who are 65 years old and older. So it's important for them to be protected by getting the vaccines.
So tell us more about the pneumococcal vaccine.
The pneumococcal vaccine is a bacterial vaccine that protects you from pneumococcal infection. It's a vaccine that protects people against 13 strains and 23 strains. Actually, in nature, there are over 90 strains. So by giving you the vaccine, we're preventing the most important ones, but not every strain of the pneumococcus.
How do vaccines work?
Vaccines are basically an injection where there's a protein or an antigen from the bacteria or virus, and we give it to the person to stimulate their immune system so that when the real attack happens, the vaccine is priming the immune system to respond in the right way when the infection sets in.
Maddie, have you got yourself vaccinated against influenza?
Guilty, Diana. I have never been vaccinated against flu. I always thought it was something that children get when they are little. Am I wrong?
That's very true, but it's a partial truth. It's very important, and Singapore has very good rates of vaccination for childhood immunizations, which is great. But there are a lot of vaccines that adults should be getting, and the Singapore Ministry of Health has rolled that out, the National Adult Immunisation Schedule, NAIS. And that is something to sort of change the mindset that adults need to do catch-up vaccines. So there's certain vaccines which are not invented when you were a kid, but are important for you to get. For example, hepatitis B vaccine, or even chickenpox vaccine. That's often a childhood vaccine, but adults who've never had chickenpox or have never had hepatitis B vaccination should get their catch-up. I would say the most compelling reasons for adults to get vaccinations would be, number one, you want to protect yourself from things which are preventable by vaccines. Number two, you want to protect those you love because you don't want to bring influenza home. And number three, you want to protect the most vulnerable people in our community. Because many of us may know someone, a co-worker or a friend who themselves might be okay, but they might have a pregnant wife, they might have an elderly parent who's sick. And so it's really important that we get the vaccines for these three reasons. We get vaccinated because we care.
Prof. Lim, I've heard that these viruses mutate how effective are this vaccination against these mutations that take place?
That's a really good question, Maddie. Viruses mutate at different rates. For influenza, there is a lot more mutation year by year, and so that's the reason you have to get a new flu vaccine every year because of the changes in the virus. The fact that the virus mutates is not a reason not to get the vaccine. The vaccine is about 70 to 90% effective, so if you vaccinate 100 people and you could prevent 70 to 90 cases, isn't that worth doing?
Yeah, of course.
Well, Maddie, we've heard a lot. Are you convinced to get a vaccination?
Yes, that's the first thing I will do. Now, I want to get a vaccine. What should I do?
Well, Maddie, I think the most important thing is to talk to your doctor, because I'm not going to interview on set. But every doctor will be someone who will walk you through the medical conditions you have and what the vaccines are that you need. It's a way to catch up on what you may have missed on the National Adult Immunisation Schedule. And they will be able to tell you what vaccines you need, whether it's influenza, pneumococcal, MMR, Hep B, etc.
That's right. And for the National Adult Immunisation Schedule, there's lots of information out there on the web. For more information, visit the website healthhub.sg/vaccinate to find out more about National Adult Immunisation Schedule and the recommended list of vaccinations. Today, we learned that diseases like influenza and pneumococcal infection can develop into serious complications, and we can prevent these diseases from getting to us by being vaccinated. So I'd like to thank Professor Lim as well as Maddie for your sharing.
Thank you.
Let's all stay vigilant and not be complacent. Prevent what's preventable with vaccination.